Ever pondered about the effects of intermittent fasting on cardiovascular health? Intermittent fasting, a pattern of eating that cycles between periods of eating and fasting, has gained considerable attention for its potential health benefits. These range from weight loss, improved metabolic health, to even enhanced longevity. However, it's not without its potential risks, especially when it comes to cardiovascular health. Potential benefits and risks can vary based on a myriad of factors. In this video, we will explore 10 considerations regarding intermittent fasting and cardiovascular health. First, let's delve into the relationship between intermittent fasting, weight loss, and metabolic health. Intermittent fasting can trigger weight loss by limiting caloric intake and promoting fat burning. Meanwhile, metabolic markers including insulin sensitivity, blood sugar levels, and cholesterol profiles can also see improvements. These enhancements contribute to a lower risk of cardiovascular disease. As your body adjusts to this fasting routine, you might just find that weight loss and improved metabolic health may indeed be a potential benefit of intermittent fasting. Moving forward, how might intermittent fasting play a role in regulating blood pressure and reducing inflammation? Intermittent fasting, a dietary practice that cycles between periods of eating and fasting, might hold the key to better blood pressure regulation. Research has been hinting at this possibility, pointing out that the practice could help keep blood pressure in check, a key consideration given that high blood pressure is a significant risk factor for cardiovascular diseases. But the potential benefits don't stop there. Inflammation, a response by your body's immune system to injuries and infections, has long been linked to a host of health issues, including heart diseases. And here's where intermittent fasting steps in again. Studies have shown that it can help tamp down inflammation in the body, potentially reducing the risk of cardiovascular diseases. However, while these findings are promising, they aren't the final word. More research is still needed to fully understand these effects and how intermittent fasting can be harnessed for better cardiovascular health. While promising, more research is needed to fully understand these effects. What about the effects on our blood lipids and heart rate? Let's dive into it. Intermittent fasting may lead to changes in blood lipid levels that could be favorable for your heart's health. It's suggested that this dietary practice can reduce LDL cholesterol and triglycerides, commonly known as the bad fats. On the flip side, it may increase HDL cholesterol, the good fat that helps to keep your heart healthy. Now let's talk about heart rate. Some research suggests that intermittent fasting might have an impact on heart rate variability, a measure of cardiac autonomic function. Some studies indicate improvements in heart rate variability with this type of fasting. But remember, these are early days in our understanding of these effects. More research is needed to fully comprehend what these changes mean for our cardiovascular health. These potential improvements in blood lipids and heart rate variability could be beneficial for cardiovascular health. There are other factors to consider when evaluating the impact of intermittent fasting on cardiovascular health. Let's delve into the potential impacts of intermittent fasting on blood clotting and endothelial function. Some research suggests that intermittent fasting may influence blood clotting factors, possibly affecting the risk of thrombosis and cardiovascular events. However, more studies are needed to clarify this relationship. Furthermore, endothelial dysfunction, which is characterized by impaired blood vessel function, is a precursor to cardiovascular disease. Some studies suggest that intermittent fasting may improve endothelial function, which could potentially lower the risk of developing cardiovascular problems. Another important consideration is the potential for nutrient deficiencies. Intermittent fasting involves prolonged fasting periods that could lead to nutrient deficiencies if not properly managed. As these deficiencies can adversely affect cardiovascular health, it's vital to ensure adequate nutrient intake during fasting periods. Intermittent fasting can also lead to fluctuations in blood sugar levels, posing risks for individuals with diabetes or insulin resistance. Proper monitoring and management of blood sugar levels are absolutely crucial for these individuals to reduce the risk of cardiovascular complications. Lastly, we must consider individual variability. The effects of intermittent fasting on cardiovascular risk factors may vary among individuals, influenced by factors such as age, sex, genetics, overall health status, and adherence to the fasting regimen. Therefore, it's important to remember that what works for one person may not work for another. This brings us to an important point. Consulting with a healthcare professional before starting an intermittent fasting regimen is essential. They can help assess your individual risk factors and determine the most appropriate approach for you. While intermittent fasting may have potential benefits for cardiovascular health, it's important to consider these factors and consult with a healthcare professional to assess individual risks and benefits.